Yeah, so as John said, it was a fantastic conference. The energy and optimism in the room with the advocacy network was enormous. And then going across to IWCLL to meet the researchers and the scientists, there were at least, 600 there, John, something like that? It was a huge amount of energy, all focused on CLL. So all of that progress that we've seen over the last 10 years, that momentum is continuing. So I think the future does look very bright for CLL and for those of us with CLL. Now, one of the things that was launched at the Advocacy Network conference was a charter for people who live with CLL. Now, this has been informed by us. CLL Support were involved, a number of other organisations across the world looking at what matters to patients and what patients should expect when they're diagnosed with CLL and when they're living with CLL. This shows the number of organisations that fed into building the charter. It was quite a lengthy piece of work, and they took the opportunity to launch it in Poland. They've come up with 6 principles for excellence in CLL care.
As patient advocates from around the world, we're united in raising awareness of the real, often overlooked challenges faced by everyone living with chronic lymphocytic leukemia. In collaboration with the entire CLL community, including patients, advocates, leading academics, and healthcare professionals, we have identified key unmet needs and opportunities to improve care. Together, we developed the CLL Patient Charter, outlining 6 core principles that every patient should expect from their healthcare experience.
I deserve an accurate and definitive diagnosis. Diagnosis is not just made on a full blood count or a CBC, but also requires immunophenotyping to ensure that it's made accurately. Unfortunately, access to diagnostics can vary, and those patients from lower and middle income countries may not get the appropriate testing to actually determine whether a patient has got CLL or not. This means that many patients may face delays or indeed get misdiagnosed, which can affect their mental health and how they talk to doctors about their treatment.
I deserve high-quality information tailored to my needs and care pathway in a language understood by me. High-quality information is crucial for people with CLL and their families to improve their quality of life and reduce anxiety. Yet many struggle to understand their disease subtype in medical terms. Consistent and clear information should be part of care to help with decisions and psychosocial needs. While initial diagnosis can be overwhelming, follow-up visits can offer a chance to tailor information to individual needs. It's also important to provide this information in various languages and formats to ensure everyone can access it.
I deserve access to shared decision-making throughout my care pathway. Shared decision-making is very important. It provides a platform, between the doctor and the patient to collaborate on what's best, treatment option available for that patient in line with their clinical diagnosis. And in the end, it will improve the quality of life of the patient. As much as decision-making is very important, there's always barriers to that. And some of them could be, health literacy, time constraints, and communication style between the doctor and the CLL patient.
I deserve access to affordable, effective care and a full range of specialists to support me through my cancer journey. CLL is a chronic condition that needs regular checkups, including regular blood tests and clinical examinations to monitor disease progression and response to treatment. While more treatment options are available now than a decade ago, getting access to these, especially in lower income countries, can be difficult due to costs and availability. Even in higher income countries, the price and other barriers make it hard to get the latest treatments, like cell and gene therapies.
I deserve emotional and psychological support from clinical allied health professionals and support networks. Living with CLL can be unpredictable and stressful, often causing anxiety and fear about disease progression and relapse. Many patients feel they don't get enough support from healthcare providers for these concerns. Since most CLL patients never reach a cancer-free phase, the psychological burden can be significant. It is vital that emotional and psychological help is offered from diagnosis onwards, with regular check-ins on mental well-being.
As someone living with CLL, I deserve access to a model of care that recognizes CLL's total impact, including its secondary effects and complications. People with CLL are at increased risk of several physical health conditions, which include but are not limited to infection, autoimmune disease, cardiovascular disease, secondary cancers, and dental disease. In fact, as many as 30 to 50% of the deaths in people living with CLL are infection-related. Ultimately, we need a shift towards a multidisciplinary survivorship and chronic disease management approach to optimize care and improve health outcomes and the quality of life for people with CLL.